Namaste. I am Dr. PARUL Dubey, working as a consultant neurologist at Manipal Hospitals, Goa. On the occasion of Epilepsy Day, I would just like to share a few points about epilepsy. First, most important thing that all the attendants or the caretakers of patients who have epilepsy need to know is what to do as first aid for a seizure. So whenever a seizure occurs, the most important thing is that we need to keep the patient safe. We have to avoid any kind of injury that can happen to the patient when he is being unconscious due to the seizure. So it's very important that the people who are around him place him in a comfortable position, preferably on a bed or a sofa, or if the patient is there's nothing else available, just on the floor, but support his neck, support his head, so that he doesn't injure himself. Secondly, one common mistake that people do is, because the patient with a generalized seizure starts clenching his teeth, they try to insert something in the mouth, which should not be done because it can injure the patient. The tongue, the teeth, the mouth can be injured. So that is not to be done. Rather, the patient has to be kept on his side, and whatever secretions are being formed and froth is coming out, that has to be allowed to pass. It should drool out, come out, but nothing should be inserted, nothing hard. And there's no role of, as such, making them sniff or breathe on an onion and all that. So that's not to be done. Other thing that has to be done is we have to prevent them from choking. So whatever secretions are being made, they should definitely be allowed to be passed automatically. Or if one vomits at that time, then they should try to put the finger in the mouth slightly. The patient is allowing to do that and clear the secretions so that they do not reach the lung. Anything very tight around the neck, that should be released. And one should keep a track as to how long the seizure activity is going on. If it is going on more than 5 minutes or so, then definitely it is a prolonged seizure and may require hospitalization. Often nowadays, all neurologists prescribe a rescue medication like nasal midazolam or something, which can be administered at the time of the seizure. So the adequate instructions usually are given that how it is to be administered. So the family and the caretakers should beforehand be aware that how that spray which is prescribed by the doctor is to be used, and it should be handy. It should be kept at a place where it can be easily reached if a seizure occurs. So these are some common things, simple things that one must do if a seizure occurs. One most important thing is that the attendants should not panic, and they should not try any extra movements or whatever is happening. Nobody should try to restrain the person, because usually a seizure would stop within a minute. But if it is extending beyond that, that means the person has the chance of going into status epilepticus, because by definition, the status epilepticus is a seizure continuing for more than 5 minutes. So at that time, the person will require hospitalization and intravenous injection of lorazepam or something to prevent it from going further into an irreversible state. So these are the important first aid points that I would like to highlight. And a few myths about epilepsy. Those things also I would like to mention here on this important day, just to create a bit of awareness. That first of all, epilepsy is not a condition which cannot be managed. Most of the times, we can very well manage this condition with adequate medications and adequate advice regarding avoiding the triggers. Epilepsy is not contagious, and people with epilepsy can lead a very, very normal life like any other person. Women with epilepsy can have a normal life, normal reproductive life, normal children, normal pregnancies, normal married life. So we don't have to fear epilepsy, rather fight it. So that's my message on this day. Thank you so much.